weeks ago. She is to continue her current medications and return to see us here at the clinic in 1 month. I'm Dr. Scott Nelson. Our topic today is heart disease, or more specifically heart attack, known in medical circles as a myocardial infarction, one of the more dramatic end results of long-standing heart disease. Now, there are two types of risk factors when talking about heart disease. There are modifiable and non-modifiable risk factors. Now, some examples of modifiable risk factors would be avoidance of cigarette smoking, observing a proper diet, controlling one's high cholesterol, and controlling one's blood pressure. Unfortunately, there are some modifiers that are not changeable, such as a strong family history. Now, happily, even though heart disease remains one of our leading killers, the prognosis for a heart attack patient is much improved over what it was as recently as 10 years ago. Now, this is a scale model of the human heart, which incidentally is about the size of your fist. Now, what is a heart attack, or what we term in medicine a myocardial infarction? It is basically an occlusion of one of the coronary arteries, or the arteries that supply the heart muscle. You have two basic types. The left coronary artery supplies the anterior surface of the heart and can be a vessel that can be occluded or blocked in a heart attack. Heart attacks of this type oftentimes are associated with pump failure, or what we term congestive heart failure. Another major type of heart attack is an inferior myocardial infarction, or heart attack involving the right coronary artery, which emerges from the aorta here and swings down through the inferior and basal surface of the heart. Heart attacks involving this artery oftentimes cause rhythm disturbances. Heart attacks, although commonly affecting older patients, can affect anyone at any age, especially if you have the risk factors that we talked about earlier. Now, therapy for heart attacks has really progressed over the past 10 years, the most exciting of which is thrombolytic therapy, or more commonly known as clot busters. This medicine dissolves clogged arteries, therefore restoring the oxygen and blood supply to the affected heart muscle. Now, there's a saying in medicine, time equals muscle. This basically means that if you're having symptoms worrisome of a heart attack, chest pain, tightness, shortness of breath, and you think you may be having one, come in and be seen. The sooner definitive therapy can be initiated, the better chance there is of you having no long-term effects from a heart attack.